Welcome to Palace University. This class is Infection Control and Universal Precautions, the framework that protects every resident and team member from the spread of disease. Infection control is the broad set of practices that prevent the spread of germs between people in our community, residents, team members, and visitors. Our residents are older, often with weaker immune systems and chronic conditions. A common cold can become pneumonia. A norovirus exposure can put an entire hallway in isolation. Strong infection control is what keeps a senior living community safe. Every infection follows a chain, a germ, a place it lives, a way out of the body, a way to spread, a way into the next person, and a person who can catch it. Break any single link and the chain breaks. Hand hygiene breaks 2 links. PPE breaks another. Cleaning surfaces breaks another. Vaccinations break 1. That is why we use many habits together, not just one. Standard precautions are the baseline. They apply to every resident, every interaction, every time, no exception, no diagnosis required. They include hand hygiene, the right PPE for the task, respiratory hygiene, safe injection practices, careful handling of contaminated equipment, and cleaning the environment between residents. Hand hygiene and bloodborne pathogen PPE have their own classes, but they live inside this framework. You will still hear the older term, universal precautions. It came from the bloodborne pathogen rules of the late 1980s and meant treat every drop of blood and every body fluid as if it could be infectious. That habit is still required today, and it lives inside the broader standard precautions framework. Respiratory hygiene, sometimes called cough etiquette, is a piece of standard precautions worth its own slide. Cover coughs and sneezes with a tissue or your elbow. A resident or visitor with a cough is offered a mask. We keep tissues, hand rub, and waste bins in entry areas and common spaces. We stay home or send team members home when symptoms appear. Some germs need more than standard precautions to stop. Transmission-based precautions are added on top. They come in 3 types based on how the germ spreads: contact, droplet, and airborne. The infection preventionist or charge nurse will tell you which apply for a resident, and a clear sign goes on the door so every team member, visitor, and family member knows what to do before entering. Contact precautions are for germs that spread by touch: MRSA, VRE, C. diff, scabies, draining wounds. Wear a gown and gloves before entering the room. Use dedicated equipment when possible: a stethoscope and a blood pressure cuff that stay in the room. Remove PPE inside the room and wash your hands before leaving. For C. diff, soap and water only. Alcohol rub does not work. Droplet precautions are for germs that spread through coughs and sneezes: influenza, COVID-19, RSV, pertussis. Wear a surgical mask when within 6 feet of the resident, plus eye protection if there's a risk of splash. The resident's door stays closed or a curtain stays drawn. If the resident must leave the room, they wear a surgical mask. Droplets fall to the ground within a few feet. Distance matters. Airborne precautions are for germs that ride on tiny particles that travel long distances: tuberculosis, measles, and chickenpox. These need a fit-tested N95 respirator and ideally a negative pressure room. Most palace communities transfer suspected cases to a hospital that has the right room. If a resident is being evaluated, isolate, mask the resident, notify the nurse, and follow the infection preventionist's plan. Watch for clusters of symptoms: 2 or 3 residents on the same hallway with the same diarrhea, vomiting, cough, or fever. A team member out sick with the same symptoms. A spike in one symptom across one wing in a single day. Report what you notice to the nurse or infection preventionist immediately. The earlier we catch it, the smaller it stays. Florida law requires nursing homes and assisted living facilities to report certain diseases and outbreaks to the Florida Department of Health and to AHCA. Tuberculosis, measles, meningitis, hepatitis, and outbreaks of any communicable disease all qualify. The infection preventionist or administrator handles the report. Your job is to recognize and tell them quickly. The faster they know, the faster they can act. Infection prevention is regulated at every level. The federal FTAG 880 under 42 CFR 483.80 requires every skilled nursing facility to have an active infection prevention and control program led by an infection preventionist. Florida 58A5 requires the same for assisted living. CDC, CMS, AHCA, and OSHA all survey it. Palace policy turns those rules into the steps you follow every day. Standard precautions every time. Transmission-based precautions when added. Watch, act, report. This has been a Palace University training.